Okay, so Brian, you were dealing with a number of issues.
Yes, I had, well, I saw Dr. Reddy for high blood pressure, extremely high. It was running in the 179s. When I was in the office, I think it hit 214 over
and what's
one
normal?
something.
Normal is less than 120 or 80.
Okay.
So that was in his office, but I suffered from diabetes for about 10 years, a little bit longer than that. And stuff was starting to break.
Yeah.
And my father passed away at 61 from the exact same issues.
So you're looking at marching toward that.
Basically at 13 years.
Yeah. But you had taken medicine to your own hands. You thought, okay, I'm going to do everything I can. And one of those things was you thought if I just like supplement, use the right supplements and do all those things and what you thought was eating better. Speaking of supplements.
These are all of the supplements, excuse me, that he was taking.
Okay, so that, we did the math on this. It turned out to be about 750 pills a month that you were taking in hopes of getting better. And of course, I know what happens when you're on the road. They ended up in your purse, didn't they?
Yes, yes, they did.
Okay, see, that's when it's okay for a man to have a man purse. You just have a man purse. But, okay, Dr. Reddy, so we're thinking that we have to take our vitamins and our supplements, and that will take care of all of our heart issues. And he was trying to reverse some damage that you had already seen.
Correct. But remember, he was taking all these pills, 700 pills, 750 pills a month. In spite of that, he had obesity, diabetes, high blood pressure. He came in, he had occasional symptoms, so I said, since you have high blood pressure, diabetes, let's do a stress test. And when we did a nuclear stress test, almost 23% of the heart muscle was not getting blood supply. So I said, this doesn't make sense. You're only 47, and you're not having that many symptoms. But still, we sent him for an angiogram. Guess what? He has disease in his arteries which cannot be angioplasty, or you cannot stent them, you can't bypass them, but he has disease in the arteries which is compromising blood flow to the heart muscle. So what does it tell you?
He was marching toward a heart attack.
Yes. In spite of taking all these medications, supplements, and the diet, and exercising, feeling tired, exhausted, and taking medications, in spite of that, his blood pressure was high, his blood sugar was high.
All right, so we say diet, like what was he doing as a diet?
Before he was a vegetarian.
Okay.
He thought he was eating right. He cut out all the meat and everything. And plus going to the store and getting all this. But he still was tired. I saw Dr. Reddy on Great Day Houston. I said, okay. We need
you gotta go.
Okay, you gotta go.
What was he doing wrong? Because there are a lot of people who say, I mean, he was vegetarian, for goodness sake. How can you go wrong being vegetarian? What was he doing wrong?
Well, the answer was simple. He was consuming salt, he was consuming sugar, starch, saturated fat, and caffeine. These are the 5 things he was consuming. Plus, when you look at all these supplements, look at all the additives they have. And look at all the side effects of those additives. These are not normal for human beings to take. So when you consume all these things, in spite of that, he was miserable.
Yeah, and the other thing, too, is we oftentimes hear, supplements can help. They certainly can help, but you got to know what you're getting in your supplement because they're not all created the same.
That is correct.
Also, the best place to get your nutrients is from your food.
From your grocery store.
Yeah, has to be, like you were saying during the commercial break, the grocery store is your pharmacy.
Exactly.
Okay, so you thought you were eating right. What was he not? You said he wasn't. He still had the sodium and the sugar. Those are the 2 things you say are the biggest culprits.
The biggest culprits for him in his case was salt and carbohydrates. So when he came in, I gave a lecture, I harassed him, I bothered him until the point he said, okay, I give up, I'm going to change.
And carbohydrates is the same thing as like sugar.
That's right. Okay. So we were actually laughing that we were actually harassing, she and I were actually getting on his case. So finally at the end of the day, he said, I'm going to change. So guess what happened? Within a short period of time, he dropped his medication for blood pressure. He dropped his medication for his diabetes. His blood pressure is normal. His blood sugar is normal. To date, he has lost close to 35 pounds. He is full of energy. He is active. He's not on any supplements. And he's taking minor medications to keep his blood supply to the heart muscle intact.
Yeah, and this is in what amount of time?
In less than?
It's been about 2 months, less than
2 months.
Less than 2 months.
All right, and here's an important point to make as well, Dr. Reddy, because I think so many of us believe that, let's say we have diabetes, that if we're taking our insulin, we're fine. And you would see in a lot of other doctors, you'd say, I'm not feeling good, and they would say?
They would say, bust your tail, let me up your dosage of your medicine. And I knew that wasn't the answer.
Yeah, because you're watching him, he still wasn't.
Watching him, I said, this is not right.
Yeah, okay, so increasing the medication a lot of times is what we think the answer is.
But the answer is simple. You have to go back to the cause. What is causing my diabetes? What is causing my high blood pressure? What am I doing wrong that's contributing to my high blood pressure and diabetes? And what should I change in my diet? All he did was change his diet. And look what happened. He's saving money. He's not taking supplements. He's feeling better. He lost weight. His blood pressure is normal. His blood sugar is normal. He's sleeping better. And even his wife is happy now with him.
'Cause literally, he's added. He's like, he lost that 35 pounds. He's looking good. And most importantly, he just added years to his life.
That is correct. Now, going on this path, was he adding years to his life? He was losing money, he was feeling miserable, and taking 750 pills. Can you imagine taking 750 pills every month, handful of pills every day, and then go and eat and still be miserable?
Yeah.